So, when couples are done having the number of kids they want, maybe two, three, four, the next thing that comes to their man's mind is it is time for my wife to get a family planning method. Yes. So they tell their wife, can you please go and get a family planning method? Sometimes most women are scared, they don't know how they're going to react to these things. And the man tells them, you are on your own. I've told you the amount of kids we want, and I'm done. You better go and get a family planning method. So for the men, if your wife refused to go for a family planning, why don't you take charge? Because I'm here to educate you on the different types of family planning method or options that are available for the men to explore. So you don't have to put the blame on the woman alone if she refused to go for her family planning. You can go for the family planning and everybody will be okay. Good day, everyone, and welcome back to Nurses Lecture on YouTube channel. My name is Mercy Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible to all my viewers. Today, I'm going to be sharing with you 8 options when it comes to men's family planning. I know you're surprised, but yes, I'm going to be giving these options, and I will encourage the men to give one of these a try, depending on what's the plan, their motives, and what they tend to achieve at the end of the day. But before we go into details into this class, if you are new on our YouTube channel and these are content you're interested in, please click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Messinero saying thank you. Let's go. All right, welcome back. So the first one I have to share with you is the one that we totally abuse, the one that we totally neglect, the one that we don't really care about when we talk about family planning. And that is the use of condoms. Yes, condom is the only type of family planning that actually prevents sexually transmitted infection, and it also prevents unwanted pregnancy. So if you are wondering the type of family planning you should go for, if you don't want to get a woman pregnant, then condom should be the best option. That takes me to the second point which I want to share with you, and that is the use of spermicide. You may want to ask what is spermicide, as the word implies sperm, side is to kill, and sperm is there. So spermicide is a cream that is used to kill the sperm. It's a cream that is used to kill the sperm that ejaculates out. So if you don't want to get pregnant, you can use a spermicide. Just that the spermicide is not 90% effective. It's less than 90% effective. So if you must use a spermicide, you should use other types of family planning alongside, maybe a condom alongside, to prevent unwanted pregnancy. So don't just rely on the spermicide alone, because it is not 90% effective, it is not 100% effective. So that takes me to the third point, which is fertility awareness. Yes, fertility awareness. For this particular fertility awareness, the men cannot do it alone. They need their partner, they need their spouse to get involved to be able to do it. Okay, when I say fertility awareness, what do I mean? It simply means helping your wife understand how to calculate her cycle, her menstrual cycle, and knowing her ovulation date. So when she knows her ovulation date, you have to abstain from sex during that particular period. Okay, so fertility awareness is not something she just put as a bonding on the woman alone. You as a man should also get involved in it. So fertility awareness is one of the way, is also a family planning method that you should take note of as a man. So when they say women should learn how to calculate their ovulation cycle, they should learn how to know their ovulation date, you as a man get involved. Know when your wife is ovulating, know when she's menstruating, know when she's on her safe period and also not on her safe period. That is going to go a long way to help you prevent pregnancy. Then the fourth point I want to share with you is vasectomy. Yes, vasectomy is a surgery done. Yeah, it's a surgery done that helps to prevent pregnancy. This surgery is done to actually prevent the sperm from going through the tube and coming out. Yet they are blocking that tube that's supposed to lead the sperm outside. So vasectomy is a procedure done. It is cheaper when compared to bilateral tubal ligation that is being done on women. It is cheaper when compared to women being on hormones for like forever. So when you do a vasectomy, you know you are done having kids. For you to do a vasectomy, you have to be sure that, oh, I'm done having kids. This is the number of kids I want. I don't want to have any more kids. Then you can go for a vasectomy. It's the risk of vasectomy is low and it's even cheaper. So you can see, you can help your wife out and just go for a vasectomy if you know you don't want to have other kids. So I've listed 4 points. Now is we are left with 4. Then the fifth one I have to share with you is abstinence. Yes, if you don't want to get pregnant, abstain from sex totally. Yeah, don't be too carried away. I know abstinence is one of the most difficult family planning method you can ever think of because it is not easy. So that is why I didn't measure it at the very beginning. I didn't measure it second or third. Abstinence is going to be difficult, especially for couples that are bonding together, especially for couples that are living together. So just take note, abstinence is there if you really know you don't want to. If both parties are happy for both parties to abstain, then that is good and fine. Then the sixth point I have to share with you is the withdrawal. Yes, the withdrawal is possible, it's effective, but it's not 100% effective. When we say withdrawal, it simply means withdrawing when the ejaculate is coming out. That's what I mean. Simply withdrawing the penis where the ejaculate is coming out, making sure that the semen does not go into the woman, rather the semen comes out rather than into the woman. Because when the semen goes into the woman, fertilization takes place, there's an egg, definitely you're going to be expecting a baby in 9 months' time. Then the other point I have to share with you is outer course. Yes, outer course simply means having sexual satisfaction without penetrative sex. Yes, having sexual satisfaction without penetrative sex. That is what some people use, especially if they are calculating their ovulation cycle. During their ovulation, they use the outer course where they know they are safe. They don't, so it's just a matter of balancing and listing them. Then the last one I want to share with you is the male hormone contraceptive. I think this is not on sale at the moment. It's still undergoing a lot of clinical trial in such a way that when they inject those hormones or when you rub it or so, it's going to like reduce the production of sperm. It's going to reduce spermatogenesis, which is the production of sperm. So in terms of this last one, I don't really have a broader knowledge on this, so I can't really give a full explanation of it. But if I have been able to get a broader knowledge and information about this male contraceptive and how effective it is, I will let you know. Okay, so for those that have been asking about the male contraception, I hope I have been able to answer this question for the now. Thank you very much for staying tuned. Thank you very much for watching. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye and see you in our next video.